Broward County is one of the largest and most diverse counties in Florida. From its beaches to its wetlands, it draws millions of visitors every year. But beyond the county's natural beauty and its booming development, there's a crisis of affordable housing. And too many residents struggle with disparities in income and education rooted in a legacy of racial inequities. To tackle these problems, leaders are banding together.
Broward County is Collaboration County.
When we put out the call, people respond.
Whether it's the Children's Services Council, or it's CCB, or it's the HIV Prevention Planning Council, or a million others, people sit together and they work together to solve the issues that are facing the residents of Broward County.
And it is that spirit of partnership that is empowering the community to work towards lasting change, to foster opportunities, and build a culture of health that leaves no one behind.
One of the major ways that organizations in Broward County collaborate is through the Coordinating Council of Broward, a coalition of health and social service agencies. We have governmental agencies, we have business, we have education.
Everybody that has anything to do with human services is a part. And so we were trying to determine what is the most important issue, the most critical issue with which we needed to deal, and it came out to be affordable housing.
Northwest Gardens was a community that had a lot of old public housing in it, and we leveraged and transformed that into 660 new apartments and 5 acres of parklets, an art studio, and urban farm.
Then there's gonna be broccoli on that end, there's gonna be collard green in the middle, and I'm gonna have cabbage on this end.
Broward County Human Services Department is responsible for leading the Homeless Continuum of Care Board in our community. So we have a substantial investment to address this Housing First initiative, which means that in our community, we attempt to place persons experiencing homelessness directly into units rather than putting them in transitional housing, and then we wrap the services around them in their unit.
I was going on 37 when I first went homeless. The job that I had basically wasn't gonna help me pay for any place down here because everything is so high. Everything is over $1,000, you know, and I don't have that kind of money.
I come and visit him once a month, and he come to my office, and we just sit down and we, talk about things that are real. So we talk about, where he came from and how he never wants to go back there again.
And by you pushing me and talking to me and having me to do the right things, and I appreciate that, because basically, I didn't have too many people that push me like this.
So we're not only talking about access to traditional healthcare services, we're talking about social and mental health. We're talking about transportation, housing, education, equity, all of those things that go into somebody having an opportunity to reach their optimal health status.
That's beautiful. Step Up is an apprenticeship program that engages high school dropouts with criminal backgrounds to get a certificate in building maintenance repair. It qualifies them to do all the basic maintenance to take care of an apartment community or an office center. Little plumbing, landscape and irrigation, painting, cabinet making, etc.
When I was younger, I got into a lot of trouble and things. When I heard of the opportunity, I went and applied. Because when I got the opportunity, I shined. That's all I needed. And I got really good at cabinets, and they wanted to put me on staff. I think that's what everybody wants. You want to have a job where you got your benefits and all those good things right there. So I think I did good so far.
There are no systems, healthcare, education, economics, criminal justice, that are not affected by racism.
What we've realized is that we need to address race equity as a way to improve our health outcomes, our educational outcomes, our economic outcomes. And we have invested a significant amount of resources in training our community so that we have a common language and analysis by which to have the conversation about race equity and equitable health outcomes.
And so what we're going to do today is we're going to take a look at how did historical racism get set up in the United States? How did that then get embedded in all of our structures and institutions? And when I mean all, I mean all.
The work that we do in Broward County is to give voice to our community. our most vulnerable students, our marginalized communities, and how we combat that through education and opportunities and resources that are made available to those groups.
Broward County about 3 years ago took upon an initiative to bring equity, diversity, and inclusiveness to all of our schools and all of our departments by instituting a new position within our school called an equity liaison. And all of our 234 schools have an equity liaison.
We'll talk a little bit about the diversity of the class.
Equity liaisons are charged with working with school leadership to make sure that all of our students have access to quality educational experience and they have access to the resources needed for that quality educational experience.
But first, let's look at exactly what the status quo is telling us.
Debate has traditionally been an initiative where students that are identified as high achieving tend to participate in debate, but we've never engaged children who are at risk of dropping out of high school, kids that don't typically participate, and we've engaged those children in debate. In my previous role as a principal, I supervised children who were incarcerated, and they debated against other kids in traditional schools across the district, and a lot of the kids who were a part of debate did not recidivate back into the system.
Some of us in here, we don't have as much power like when we speak like our own words.
We've had tremendous success. Not only is it giving our kids a stage to really talk about the various topics, but it's improving their self-esteem, it's giving them confidence, it's helping them with life skills.
We have been data-driven from the beginning, both in identifying the needs in the community and then in checking back to make sure that what we're doing makes a difference. So we look at pretty much every aspect of a child's life and try to look for those places that the data tells us we can shift the trajectory.
Any conversations you've had around HIV and AIDS, we're looking for those stories as a way to preserve history.
We have the second highest rate of new HIV/AIDS diagnosis actually in the United States.
And so we've done a significant amount of work in community outreach and engagement in order to get those folks identified and quickly into treatments.
I was without my medication for a month and like a week and a half. That was very serious because I began to get sick. I had to go to the hospital.
We make sure that they get to their medical appointments, that they're linked to other resources like housing, food assistance, treatment for mental health and substance abuse issues.
Now I'm back taking my pills, I'm back on the right track, I'm feeling back well, I'm back at work, and I'm healthy again.
We have staff that do what we call observational surveillance. They go out into the community, they talk to folks. They look at where risk behaviors may be taking place.
You take it once a day, every day. It's monitored by a physician. It helps you from contracting the virus.
People are very, very friendly, and I do like this, and I'm glad that you guys are reaching out.
I think that we're starting to see the effects of our efforts. From 2016 to 2018, we had an 11% decrease in the number of new HIV infections diagnosed here in Broward County. That was the biggest decrease in the state.
The work around recovery from the shooting in Parkland actually has transformed us in a pretty fundamental way. We've brought in a variety of different modalities of trauma treatment, whether it be the Center for Mind-Body Medicine, or cognitive behavioral therapy, or EMDR.
Just gently bring it back each time to the breath. The breath coming into the body and the breath leaving your body.
That safe space to go and feel comfortable is going to be vital anywhere.
Let's just kind of check in with everybody. And how are you feeling? How was your day today?
In the budget going forward, we have built in funding to create centers like Eagles Haven around the county, recognizing as well that we work with those communities to identify what aspects of Eagles Haven do they think would be useful and who are the trusted partners that would make such a center be worthwhile.
So education is critical to a culture of health. All the data will tell you that those who have a post-secondary education, they will have longer lifespans. They make better decisions around their economic health, around their physical health. What we were able to do is uncover the unemployment rates and college-going rates in every zip code in Broward County. We found a number of zip codes with 9, 10, 12, 15% unemployment. In order to change that, we actually have to engage, right? We have to have proximity with these communities and to help make that difference by ensuring everyone knows, notwithstanding their circumstances, that college is an option.
And literally, Broward College changed the whole trajectory of my life.
I am extremely proud of the work that is happening here in Broward County.
It can be done, and Broward does it because of the people in this community.
This community comes together to help our residents in a meaningful way. We show up for our community.
I think the collaboration, I think the willingness of the taxpayers to really step up to the plate and invest their resources in the health of the community makes me optimistic.